Hi, y'all. It's your girl Shay back for another one. Two in a week, y'all. We going up, like I said before, and like I always say. Y'all, we got Dr. Andre Johnson in the building from the D, y'all, from Detroit. Sir, how are you today?
I am wonderful. How are you, Shay?
I'm doing well. I'm doing well. Blessed to be here. I gotta know everything about y'all. His resume, his bio, his IMDb, whatever you want to call it, is popping. This man has done a lot of amazing things, and so I want to dig into it. But I really want to start out with just you. And so I always start out with asking all my guests, if no one knew who you were or what you've ever done, who would you say Dr. Andre Johnson is?
Sure. Well, let me just give you a little background information. I am a person in long-term recovery, and what that means is I haven't used any drugs or alcohol in over 36 years.
Mhm.
I was fortunate to get clean at the tender age of 18. And if it had not been for recovery, I certainly wouldn't be a Dr. Andre Johnson. I wouldn't be a husband to my wife. I wouldn't be a father to my daughter. I wouldn't be a recovery activist. I wouldn't be a recoveryologist. Everything I do is recovery associated. Um, I got early in life, I have a very colorful past. I was really into the streets at one point. Trying to become a major drug dealer and found myself strung out on cocaine at the age of 17 years old. And from that experience, it led to unwanted interaction with law enforcement, which led to um, you know several offenses, but also it also led to an escalation of my addiction. And as my addiction escalated, I found myself having suicidal thoughts. I found myself experiencing depression. I found myself experiencing suicidal thoughts. And it was from that experience that led me to go into a drug rehabilitation center here in the city of Detroit. And once I had entered that drug treatment program, I spent a total of I did two stints back to back, short term for 14 days and long term for 120 days. And I went from there to living in a recovery house for 2 years to kind of transition back into society and make all the necessary changes I needed to make to continue to live a drug and alcohol free life. Um, and I knew it was something about my experience in treatment. I felt like I remember, you got this tall, skinny black kid from the inner city that's in a rehabilitation program, interacting with a therapist who was a 5 feet white woman at the time, and I hadn't really had a lot of experiences with white people during my early stages of life, growing up in a predominant black community. Um, but the therapist was probably one of the most kindest, loving, empathetic type therapists that I ever. The interaction and experience really helped me to the point where once I completed treatment, I felt like I was Luke Skywalker, the
Yeah.
force in me. I thought she was my yoga. And so she gave me a lot of hope, a lot of um, insight about a lot of things that I had never really thought about because I was a walking around highly depressed, highly sad, highly conflicted, and having that experience, um, I would say woke me up. And once I woke up, it wasn't no looking back. It wasn't no looking back. Yeah.
Can I ask you, when you was in that experience and that part right there where that therapist was really somebody who was a major support system, did you have any other support in your life at the time? Was it not really? Or tell me a little more about that.
It was somewhat limited. I mean, I had my mother was a registered nurse, educated woman who really stressed the importance of education in our home. So she was my role model at the time, but I had become a disappointment to my mother. So our relationship had become estranged because of my addiction. I mean, my mother's home got shot up because of some stuff I got into. You know the backstory of what
Yep.
happens when you're in that life. And so for me, I needed time to really take advantage of the services and the people that were in my life that was guiding me and helping me in my recovery process. I had a lot of family members. Obviously, they love and care for me, but they didn't necessarily have the skills it take to help somebody who's struggling with addiction. Um,
Okay.
Generally, people struggling with addiction or struggling with some type of mental health challenges need professional help. I think your loved ones can only do so much, and sometimes the loved ones can perhaps become an enabler. Um,
Yes.
and things like that. So for me, I was at a crossroad in my life where I knew I needed to stand on my own 2 feet as a man. I knew I made a lot of poor choices early in life, and I knew that it was going to take me and a higher power and a God and the right people in my life to keep me on the right path. And to stay on that path and that journey wasn't necessarily very easy in the beginning, but it got easier the longer I started staying clean and sober.
Amen. So I want to say, and I want to go back to what you said, which was so powerful, that sometimes how the people, the support system in our life can be that crutch sometimes. I
Mhm.
actually was just talking to a coworker about that, about how not even necessarily that sometimes your family can be a crutch, but sometimes your family can be not even a good support, even when they think that they are. Like we've experienced having patients or clients or people come into our facility where the family, they're 100% behind them, but it's almost like that self-efficacy, that self-autonomy was gone. And so like I had one lady come in and her mom was just 100% supportive, but she couldn't make any decisions. You know, her mom was kept jumping in saying what she wanted, and I'd love to see her do this, and I'd love to see her. And then the patient at the time was just kind of like, uh-huh. Yeah, like just like agreeing with everything. You know what I mean? And so it definitely can be a detriment to someone's recovery and to how they stand out. Like you said, you need to be a man on my own. Like I don't, you know what I mean? Like regardless who was in my corner, at the end of the day, I got to stand in these decisions, whether you like them, whether mom likes them. You know what I mean? Like I got to stand on my own. And so I think that that's super powerful to that we're talking about, because I think some people and some families need to hear that. So that's wonderful.
And I think there's a disconnect, Shay, between families and family therapy and family support and family treatment. I mean, often individuals go to treatment, and so they're alone. They're feeling alone. And that loneliness, sometimes you want to be with your family. You want to make these amends, but the biggest amend an individual can make is an amend to themselves first.
That's good.
And so often, I think we get clean or we gain weight, our skin start looking better, and we want to show the family we're doing better, but we haven't showed ourselves long enough. You follow
Yeah.
me? It takes time. Recovery is a process. It's a journey. It's no destination. It's no end. And so it's important that recovery and sobriety becomes first and foremost. And it's all a balance, it's a juggling act because a lot of times we all come into this process in different stages in life where some of us may have more support than others, or perhaps, and I think family members often have good intentions, but
Right.
those good intentions don't always align with what recovery and sobriety look like. Because you'll have a family member say, well, can't you just have a glass of drink, or perhaps you can just smoke a joint? But when you're struggling and you've suffered from the disease of addiction, no, you can't have nothing. You know,
Right.
the recovery process that I embrace was, complete abstinence. And some people don't understand that. Or in some cases, after you've been clean a couple of years, well, maybe you can just do a little bit every now and again, and people don't understand that. So that's why coming into our own understanding, building a relationship with self, and it's learning some self awareness and learning how to be okay with self, learning how to be one's authentic self, learning how to be intentional with self. All that is a process. And in order to get to that process, or go work through that process, you have to kind of like block people out. You got family,
Right.
you got friends. A lot of people always love seeing what you could be doing, what you should be doing, and then that becomes a distraction. And then we have to examine the things that stress us in life. We have to examine our stressors. And, the more we begin to examine our stressors early in recovery, we begin to build what I call a recovery, a sobriety foundation, because now we're not operating and we're not responding to the things that cause us stress in life, whether it's just toxic relationships, or the old negative things that may have been said in our lives, like you ain't gonna be sugar honey iced tea. You never be sugar honey iced tea, or you can't do that, because people and sometimes family put limitations on what we can do, and we start to embrace that. And we got to learn how to embrace ourselves. We got to learn how to embrace ourselves and build new relationships. And that's why, I wrote this book called Recovery Ecosystem, because, I look at it like this. If I was to ask you, Shay, how would you go about creating a farm? What would you say?
I
What
don't
would
know.
Right. And that's how recovery is. And that's how sobriety is. But you got to learn. You got to learn it, because if somebody says, Shay, I'm about to give you 50 acres, first thing you want to do is consult with somebody who's been successful with building a farm on 50 acres. And so part of the recovery process or the sobriety process is what? Connecting with people who have that experience, connecting with people who have the strengths and the hope. And the more you begin to do that, that's when your process begins.
That's amazing. I don't know if it's a metaphor or analogy. I don't know, parable. I don't know, but that was an amazing way to put it. And I've been in the game. I've been in working in recovery for over 5 years,
Okay.
training and working it. And I'm myself am a woman in long term recovery for over 12 years. But I've never heard. I know. Thank you, and you too. Big ups to you too. Okay. But I've never heard it put that way about the farm, and that's actually that's an amazing way to look at it, right? Is like, yeah, if you don't know what you don't know, right? Like, and so you need to, to get with community.
And then
Um,
when you think about a farm, you got to think about what? The sun. You got to think about the soil. You got to think
right,
about the water. You got to think about the proper foundation. You got to think about what's under that soil. And you got to worry about the seeds, the weeds. And for me, it's sometimes we got to weed certain people out of our lives.
that's great.
We
Yeah, I
need
think that's with everything too. You can't take everybody with you. I don't care what you're doing. You know what I mean?
absolutely, no doubt about it. No doubt
Yeah.
about it.
So, okay, I want to go back to a little bit to what you talked about abstinence, and I'm kind of going back, and we're gonna move forward. But do I hear you saying you don't necessarily believe in harm reduction, or that just didn't work for you? Or talk, well, first of all, can you talk about what harm reduction is for those people who may not know, and then tell me what your thoughts are on harm reduction?
Absolutely. So harm reduction is a service. In fact, the agency that I founded 20 years ago, we provide harm reduction services,
Okay.
where we provide syringes, we provide pipes, we provide all the works people need to use drugs. Um, and the harm reduction model itself is a model that's designed to help prolong life and help people to stay healthy. And so that means that if you'd rather somebody, if they're going to use drugs intravenously, you want them to use a clean needle versus sharing needle. Why? Is because it reduces HIV rates, it reduces hepatitis C rate. But also for me, it's there's a window of opportunity at times where sometimes we can perhaps help an individual to be motivated to further their recovery or seek their recovery, because recovery is an individual choice. Um, and part of the process, and I know you're a trained certified peer, nationally trained certified peer specialist, where we're trained to meet people where they are. And so if we meet people where they are, we want to meet them where they are based on the motivations of change spectrum. Some people at pre-contemplation, some people at contemplation. And so in the harm reduction space, one is the big win is if we can reduce HIV rates, we can reduce hepatitis C rates. It's a very controversial model, but I find it to be helpful. Why do I find it to be helpful? Because I've lost relatives who died from HIV, and I've lost relatives who were IV drug users, sex workers, and the whole shebang. So it's near and dear to me as it relates to providing this service. Now, my personal recovery, you notice I said personal recovery,
Hmm.
is I believe in complete abstinence. I live a complete abstinence life of free from any drug, alcohol, or mind, mood altering chemical. That's my lifestyle. However, I do not judge other people's lives. You know, it's not my right. It's not my right to judge what other people choose to do. We all have to, make our choices in life.
And I'm with you too. I am one that I can't. For me, there's no social using for me. I have addictive personalities. So if I use, I'm off to the races. Like you know what I mean? Like one little bit, it's a wrap, it's over with. You know what I mean? And I know that. And I know that. And I tried it. Like I tried to, see, oh, maybe I was one of those that I could be the social or I could do the harm reduction model. No, and I think it's important and even powerful to learn that about yourself, to know like, hey, nope, I got to put these boundaries up. That's not for me. I'm not that person.
Hmm.
Um, Harm reduction is super controversial. What do you say? And then I want to talk about DRP, your organization. What do you say about those? Because there's a lot of people that say you're enabling them when you're like, like and I'll be honest, when you it sounds kind of crazy when you said, oh yeah, I provide syringes and pipe, like it's, and of course I know what you mean, and I know, but I guarantee people who ain't familiar with it watching this was probably like, did I hear him correctly? That he just said he provides all this stuff for people. What do
Hmm.
you say to people who are saying that all we're doing is putting the stuff back in them, all we're doing is enabling, we're not helping when we're using the harm reduction model?
Sure. So I would say to those individuals who may oppose it, um, hypothetically, if it's your sister, if it's your brother, if it's your child that's using needles, would you want your child to use and share a needle with another user, or would you want your child to have a clean needle to perhaps preserve he or she's life? Um, um, because really that's what we're doing. We're preserving life. We're meeting people where they are, and we're putting people first. I mean, to just say, what somebody else need, I think it's always easy to say what other people don't need when you don't really understand what they are experiencing. For us, it's about having true, genuine care and concern for individuals that's using, which is a form of empathy. I mean, we have to empathize for people who are struggling day in and day out, because that one day clean from using a clean needle may help that individual. I mean, I got 2 phone calls this week of young people who were 21 and 19 years old, HIV positive. Uh,
No.
and so HIV positive rates are primarily exploding in marginalized populations. And it's exploding between like the ages of 14 to 25 years old. And so what usually happens is a lot of cases, older people who may start sharing drugs and sharing needles with younger people who may have the virus can pass it, or in some cases it can go vice versa. And these are things that can be prevented. We are, we work in this space where we provide prevention, we provide treatment, and we provide recovery support services. And so if an individual tests positive, then it's our jobs to link that individual up with the proper medical care, but also other what we call ancillary services that people often need, which is housing, which is perhaps some career or resume building, some wherever. Meet them exactly where they are. So, I think that it's a lot of education. It's more education that we need to do in our society to help people understand the value of harm reduction. It's a lot of resistance. I mean, uh, but it's. We have a mobile team that's driving out in the community. I have nurse practitioners that's part of the mobile team. I have recovery coaches and social workers, and we're making a difference in our community. Because what are we supposed to do? Just leave the people out there, just continue to use drugs recklessly? I mean, we're not responsible for bringing these drugs in these communities. So at the very minimum, I think, and I'm thankful that we have a government that have earmarked resources to support the community.
Well, and I think, and well said, 100%. But like from the street perspective, they gonna do it anyway. You know, like at the end of the day, people are going to use anyway, right? And then it gets to a point to where, like you said, using recklessly, to where they're going in houses trying to, you know what I mean, or they're doing whatever, using whatever to use. And so at the end of the day, if we are meeting them where they're at, so they can use clean needles or they can get whatever they need, and then in the same space we can still talk with them while they're there and say, hey, we know that you're doing this, but there is a different way. It may spark something. Then you know what I mean. So 100%. I want to move on. We still got a lot to talk about. This time be going by so fast, Lord.
Mhm.
um I want
Yeah.
to get into your catalyst for starting the Detroit Recovery Project. And I want to talk a little bit about Mark John again, because that's how I met you. And so
Yeah.
I'm gonna leave it up to you. Which is first? Do you want to talk about how? Because like I said, the late Mark John again, pioneer of TCRP, Twin Cities Recovery Project. Some people don't know, but I'm out here in Washington, but I've lived in Minnesota for I think it was about 11 years, about 2 years ago, and that's how I heard your amazing name and amazing stuff that you were doing at DRP was through the late Mark John. Again, I know you were very close with him, and so tell me about your relationship with him, and then we can go into how you started DRP.
Yeah. So let me go to reverse, and I think
Okay.
that we'll just kind of keep some chronological um, aspects. So I started Detroit Recovery Project as a direct result of the need of, looking at the data. Back in 2001, the data in Detroit revealed that an average of 14,000 people were in the treatment system, and excuse me, at least 80% will return to active drug and alcohol using within the first 30 days of exiting treatment. And so for me, it was like, how do we build and create a safety net to support people upon completing treatment? And the late Dr. Calvin Trent, who was like a mentor and a supervisor to me at the time, said, "Hey, we got to do something about this, Andre. And I'm going to give you $100,000 of seed money to start working on something." So I got the $100,000 and started bringing in speakers. And at the time, I was working out of the city Detroit Health Department, and we were doing relapse prevention workshops every Tuesday from 6 to 8. And I would have hundreds of people in the health department um, seeking and to understand what relapse was, what it is, and what type of relapse prevention tools they can have to reduce their chances of relapsing. And it was from that experience that I realized that, okay, you can't take a clean fish and put it in dirty water and expect the fish to
Mm,
stay clean. And I think often when people go through rehab programs, it's easy to go through a program for 30, 60 days, but it's the support people need when they're in the community. And if they don't get the support in the community, then how can you have an expectation that they're going to maintain sober, that they're going to maintain sobriety and recovery? And so for me, it was about developing, but it was also understanding what the needs were for the people. And some of the basic needs I understood was people didn't have a lot of relationships with people who were drug and alcohol free. So one of the things we invested in, well, later after the 100,000 a year later, we got a $1.4 million recovery community support program from SAMHSA, and it was at that point where we now had more resources to pour into our community and to hire a team of recovery coaches and train these recovery coaches. And then we required acquisition. We had a house, a big historical mansion home that was called our Recovery Community Center. And it was from that point, we would have 12-step meetings. We would have sober dances. We would have recreational activities. Guys be playing dominoes. They talk about each other real bad. You alcohol going on, but all they doing is drinking Coca-Cola and coffee and having fun and talking trash. People be playing chess, they be playing checkers, and it was creating this fostering environment where now people can have relationships. We had a recovery basketball league, we had a bowling team, we had a chess team. It was a place for people in recovery to be among other people in recovery. And we use something called peer led, peer ran, peer driven approach. And the more we did that, we just exploded. And now we have two recovery centers in the city of Detroit. Detroit is broken off into east and west. We have one on the east side, we have one on the west side. They both in the belly of the beast. And what I mean by that is not the most desirable areas to live in, but it's in communities where the services can be access and benefited, and they're both off of a bus route. And so as we evolved, I began to learn more about okay, we're doing all this stuff for people in recovery, but perhaps we need to integrate some other services. So some of the other services I realized we need to integrate was mental health. We didn't have a strong team to provide mental health services. We know that 87 between 70 and 80% of people who have experience with drugs and alcohol often experience some mental health challenges, whether it's depression, anxiety, or personality disorder. You can't use drugs and alcohol for long periods of time and not have those kind of experiences. So for me, it's how does our recovery center begin to provide those services for our community? So now we have the psychiatrists, we have psychologists, we have multiple master level therapists who've been trained to help provide what's known as co-occurring services, meeting the client where they are. And then obviously, being in the city of Detroit and being aware of the social determinants of health, where marginalized communities, black and brown communities, often have some of the highest rates of chronic illness, high blood pressure, high cholesterol, diabetes. You get clean and then you start eating crazy, right? Then you
Mm.
don't want people to start dying by the fort. So for me, now we have two nurse practitioners, we have a medical doctor, and now we provide more holistic care. And so we've been evolving, and since the inception of the agency, a lot of other organizations started working to emulate the work we were doing. So one time I was in Minnesota, actually speaking about some of the work we were doing in Detroit Recovery Project, and this sister walked up to me named Miss Tate, Latricia Tate. Said, hey, can I have your number? I love what you're doing, and da 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 da. I was like, yeah, sure. And the next thing you know, she called me 2 weeks later with her significant other on the other line, which happened to be Mark Jonikin. And Mark was like, Mark told me later, I just wanted to check you out, make sure you weren't messing with my woman.
Uh-uh.
But Mark and I began to talk, Shay, and the more we talked, we discovered we had more in common. And he truly became a brother that I loved and cared for. And his passion and his energy for wanting to embrace and build the community, Twin Cities Community Project was emerged. Now it's a nonprofit that's been around Minnesota for a significant amount of time, predominantly in the black community where the services need to happen. And it was under Mark's leadership. And for me, it was kind of easy. Um, it was easy for me to begin to kind of mentor Mark about some of the ups, the downs, the barriers, the challenges that I experienced building a recovery community organization here in Detroit. Mark would come out here in Detroit and stay a week or two. He loved Detroit like it was a second home. And then I would spend, quite amount of time in Minnesota, and Minnesota had become like a second home to me. Mark would connect me to everybody he knew, like yourself, at the annual um, uh, fundraiser event. And so
Oh
for
yeah.
me, Minnesota was, already known for treatment, I forgot what they call it, the land of
The
um,
treatment center, the land of the treatment centers. Over 400 of them, y'all.
yeah, yeah, but not recovery centers. And Mark was probably one of the first black men out of Minnesota to help build a recovery community organization that was culturally congruent for people of color. And I think and Mark was very uh, perceptive and open to building allies, building relationships with people of all walks of life. My heart was broken when I got the news that Mark had had died from an auto accident, and just knowing about the details. But his legacy continues. Miss Tater's doing an excellent job, continuing to build and run the organization day to day. But yeah, that's kind of how Mark and I relationship just evolved from that
I,
introduction from Miss Tate.
he was such a memorable. I mean, Mark. He is amazing, loud, always on his phone. But I got a shout out to Latricia Tate because, and I don't know if you know this, doctor, but she was my first interview on this show.
Really?
Yeah, she was my very, so y'all go back and look at when I was a little baby, okay? How
Oh,
I was, yeah, she was. That's why this is full
yeah,
circle. Yeah, she was my very first one. And I was like, girl power, thank you for doing it. But yeah, she was my very first interview.
yeah,
So yeah, you
she's
can go back and look. So she's amazing, holding it
incredible.
down. Yes.
Incredible. So I still work with Miss Tay. We talk quite a bit, and I kind of consult and mentor her as she's continuing to build and develop TCRC.
When I did my interview with her, I was shocked because, like I said, I've been gone from Minnesota not that long, but it's been a couple years now. That she has two or three facilities now. TCRPs has grown so much,
Yeah,
and like one's inside of like the fireplace or something. I
yeah,
said, what?
right. Yeah, yeah. She's really taken off. She's expanded. She's really just replicating. I think Mark had a lot of relationships and visions in the mix, and I think it made it really easy for Miss Tate to step in, excuse me, and to do what Mark has started. And she's done an absolutely incredible job. So I definitely would give her kudos for the stand-up woman that she is, because being a black leader in this space is not always easy.
100%. And we talked about that too and I know we probably don't have time to get into that because I want to talk about you working on your PhD and what that looks like. But yes, we all know that. I mean, being black in America is not always it's not there's good times and bad times, right? And so, but definitely in the spaces that we're in, and I know that, and I'm not familiar too. I don't think I've ever even been to Detroit. I've never been, and I know that I heard there's a lot of black people there, but I know in Minnesota, it definitely was not a plethora of RCOs that I think none that were black ran, black led. And so Mark starting that was a huge thing. And I think other ones, and if I'm wrong, I apologize to any other African American RCOs that did start in Minnesota before TCRP. But I know when I was there, I just didn't you didn't see a lot, and I know that it was probably difficult. It was difficult for me being a leader at one, and being in those spaces and being in those rooms alone, right? Like no one else in the table on the councils and all the seats that I was on, looked like me. So it was a blessing to be in that room, but it also is sometimes uncomfortable, right?
Yeah, sure.
Uh, okay, so I know we're getting short on time. I want to talk about, and I want to say really quick because we do got a little bit of time, but you are a doctor. When I met you, you were not. So what was the catalyst for that? And talk a little bit about that journey.
Yeah, so I've had several experiences on my recovery journey. Um, like I mentioned a minute ago, I began to really learn and understand the value of providing mental health services, and learning what bipolar, learning about borderline personality disorder, schizophrenia, depression, and anxiety. So a lot of that stuff I didn't really know. And I thought to myself, if I'm going to be a leader in this space, then I have to be up to challenge myself because I challenge people every day to challenge themselves. So for me, I found a clinical psychology PhD program with a humanistic lens. And what that means is it's really, psychologists that's trained to um, work and do work that's meaningful, but also with the lens of social justice and a lens of bringing that empathy into the space where, I'm trained to work with people of all types of disorders. So for me, now that I'm a psychologist, I can communicate and understand when psychiatrists are talking to me about medication, because psychiatrists are generally want people who prescribe medication, and psychologists are typically the highest trained individuals to work with folks who have mental health disorders. So I committed to a rigorous 4 year full time doctoral program after 50 years old. Say, I was literally 50 years old at the time I started my doc program. And obviously during that time, a year later, it may have not even been a full year, and then COVID-19 came.
Oh, okay.
So it was, a time where we had to pivot from being in the classroom to being on the computer um, um, 4 to 6 hours a day, and learning via Zoom. So it was a challenge. It was a lot of work, but I learned so much about myself, but also so much. I have so much appreciation and compassion for um, individuals with mental health services, individuals who've experienced trauma. So I had a friend who was 28 years old. His name is Antonio Dudley. Handsome young fella. He was the friend that, when we would go out and hang out at clubs and things like that, he would strike up a conversation and have the women laughing and just gregarious. But Antonio struggled with schizophrenia. And a lot of my friends we were all in recovery from drug and alcohol, but he had a mental health illness. And people in recovery told him he didn't need his medication for the mental
Mm.
illness. And one day, Tony was hearing voices and he wanted to stop, so he put a shotgun in his mouth and blew his brains out.
Sorry.
That was devastating. That was in 1998, and so for me, that was one of those moments in life for me, like, wow, I didn't know about this, and had I known a little bit more, perhaps I could have encouraged him a little bit better. I've met and I know people, um, you know, who've committed suicide.
Mhm.
And, usually when people get to that point, they are struggling with extreme, severe depression. And again, so now as a psychologist, I have an opportunity to engage people in conversations when I pick up signs and symptoms. And now I think I can be a better leader running an organization. We're about 70 employees, so we're still considered small compared to some of my colleagues. But I think I'm a little more informed than most CEOs in this space because a lot of times, um, we run these organizations and they take all our time and energy. But now I'm also able to pivot. I'm doing forensic psychology. I had one of my first cases where I had a 30-year-old young man had shot and killed his 25-year-old pregnant girlfriend. Wow. And they were both under the influence of alcohol, meth, cocaine, and marijuana, and they had been on a 10-day binge. And this young man was facing a death penalty for his crime. And now I'm not saying it was okay for him to do it or to forgive him, but I personally don't subscribe to the death penalty. And so I was able to work with the legal team, and we were able to have to take the death penalty off the table. But he does have 50 years to serve. And so for me, it's doing meaningful work to help people who wouldn't ordinarily get the help they need during the crisis. I mean, people often who haven't experienced crisis sometimes lack the empathy that's needed to help others in crisis. You know what I mean? And so for me, is how do I begin to take all of my experiences um, in this professional realm, my experiences in the personal realm, and be able to bring something that's meaningful, impactful, purposeful, and to our community.
Amen. Well, you're definitely doing God's work, 110%. And so we appreciate that. How can people give to DRP? I'm so used to saying TCRP. How do people give to Detroit Recovery Project? Can you talk about that?
Yeah, well, first and foremost, we do have a website, and that's www.recovery, the number four, Detroit.com. That's www.recovery, the number four, Detroit.com. And if people want to go, if they want to make a contribution or a donation, you can go directly to our website. There is a link where you can, make a donation or a contribution.
And do you happen to have one of your book, The Recovery Ecosystem? Do you happen to have one of those to show? Because it's saying sold out, Doc. I'm looking on your
Um,
website. Are you sold out? Are you getting it like that?
Yeah, I sold out, but I actually just got a new batch in today. They're in the car, but I tell you
Okay.
what, send me your address and I'll send you a book, okay?
Oh, that's so. I was just getting ready to hit buy, but it said sold out. But hey,
Yeah,
I'm with that.
yeah, send me text me your address. I'll send you the recovery ecosystem book. In fact, that book is where I talk about the value and importance of having an ecosystem to help people sustain their recovery. I mean, we got to talk more about helping people sustain long term recovery. We need more. There's another Shay out there right now that need 12 years, that need to
Amen.
that can hear from you. We need another Shay out there that's creating a podcast and bringing some inspiration and some hope to their community. You're doing amazing work, Shay.
Thank you so much, and I'm happy. That's a beautiful. That's why I like you. That's a beautiful segue into y'all. My book is out. We see on my little screen. Oh, you can't hardly see it.
Can't see
Okay, but
it.
you can't see nothing. All
You gotta
right, but I
move
got.
it. Yeah,
Oh,
you
here we
gotta
go.
the
There you
person.
go.
Yeah, okay.
There you can see it now. Okay, there you go. And so this book is my story, and actually it's a trilogy, y'all. And so there's three of them. A lot of y'all have seen that, and so I just want to say real quick, because for those of y'all that don't know why, it's my show, and the book is called His Purple Peculiar Treasure. It is derived from my story, but it's also derived from Exodus 19:5, which talks about being a peculiar treasure. And I won't go all into that, but that's the reason why, and that's where all this comes from. And like I said earlier, I'm in recovery 12 years, and I have a very, very, very colorful past. And so
Mhm.
the books talk about, and so this first one, the first one's the beginning and on up. And so please, that's on Amazon. Check that out. Or keep checking out these amazing, amazing interviews I'm being blessed to be able to do with these amazing people. Doctor, thank you so much for being here. Like we said,
Absolutely.
like I told you before, I didn't quite get close enough to meet you the first couple times I've seen you. So I really do appreciate the time you took with me today.
My pleasure. My pleasure. You are a treasure indeed. Thank you for inviting me and being a part of your show, your podcast. I'm learning from you, Shay.
Hey, you better get on. You better get one. Everybody's kind of doing podcasts kind of now, and I think it's amazing because at the end of the day, we all have a story. We all have what everybody says now, POV, a point of view, right? And so if you have people that are willing to listen and you can share your experiences, I'm all for it. So I'm looking for the Dr. Andre Johnson podcast whenever.
All right. Thank you. It's coming. It's coming.
I
It
know
is
that's
in
right.
the works. I literally have all my equipment already. I just haven't started.
Look, I hear you. Y'all, it's been another one. It's been absolutely amazing to be here with Dr. Johnson. And so I just want to tell y'all, keep watching out for me. It's Shay, HPP Treasure Talk. Set apart and set aside. I'll see y'all next episode. Bye bye.
Man, thank you.